Hi, I'm Dr. John Hamill. Welcome to Complete Laser Clinic. It's great to have you on board. Let's talk a little bit about the history of the clinic, what we do here, and where we're going, and what's expected of you. We started this company in 2003 in Morganton. We've grown into up to 6 locations with multiple satellite locations. We practice cosmetic surgery and medicine, bariatric medicine, anti-aging medicine. We do a lot of things at a very low price. Our mission statement is we do great work at a fair price, all to the glory of God. We are a Christian company, and part of what we bring in does go to Christian ministries. These are some foundation principles I want you to get familiar with. The other things I really want you to understand is the type of lasers we use, which are from the company called Alma Lasers, their wavelengths, and the name of the lasers. We use products called Abaji, which is a prescription skincare medical line, meaning that it's prescription skincare, there has to be a doctor. We use Triluma, which is also prescription skincare, and we use Jane Iredale makeup, which is a medical makeup that you wear even when you're sleeping because it's so good for you. What I'm telling you here today is some key principles for you to understand. We do bariatric medicine, which is weight loss. That's the backbone of this company. We do a lot of weight loss and we do it well. We combine that with our liposuction. We do a lot of liposuctions using lasers, using infrasonic cannulas. So I want you to understand that. I want you to understand how weight loss ties into liposuction, how liposuction ties into other cosmetic procedures, and how everything works. You are our main line out front. When a patient walks in the clinic, they see you. They make their impression immediately. You need to be wearing a white jacket. A white jacket is very necessary in this company. It gives the professional image. You need to be having closed-toed shoes because you might be in the room doing a procedure and we want your feet covered. So white jacket and closed-toed shoes. There are managers and there are visionaries for every department. A visionary is someone who believes in the mission of the company and is helping the company to grow. That's called a visionary. And we have visionary meetings every quarter where we set goals and discuss the growth of the company. You one day too could become a visionary. Get with your department head. There's department heads for every clinic and every department. Learn what it's expected of you. Get to meet me, get to know me. You're going to have a packet of information. We provide medical insurance. We provide malpractice insurance. We provide bonuses. We take good care of you here. We even provide a retirement in the form of 401k. It's great to have you on board. I look forward to working with you. I do expect the best out of the best. If I don't see you give me your best, then I'll have to sit down and talk with you. What I mean by that is we are open 7 days a week. Nights and weekends are a must at this job. And I do want you at your best. I don't want you working another job and then coming here to work. So if you have another job, you might want to talk to me about that before coming on full time. If your outside commitments do not let you work nights and weekends, that would be important to discuss with me so that there be no hard feelings. All right, great to have you on board. We're looking for CLC superstars, the best, and that's why you're here. Hi, this is Dr. John Hamill, Complete Laser Clinic 2011. Today I'm going to show you how we numb a patient, and we're going to do a little bit of permanent makeup on their upper and lower eyelid. A lot of people have the question, how do you numb? How do you make it numb? Well, the numbing part is the most painful part. I'm going to slowly go through it with you so you can get a good view of it. First thing we use is tetracaine. They're numbing drops for the eye. You ask the patient if they have any contacts. Rose, do you have any contacts in? Rose, do you have any eye problems?
No.
Okay. I'm going to pull her lid down. You put the numbing drops at the corner. You let them roll in. You don't drop them in. You just let them roll in. You let them sit in there. Let the eye get good and numb. Then what we use is lidocaine with epinephrine. It's the epinephrine and the pH of the lidocaine of 5 that causes the sharp burning pain. Slow injection in the sub-Q tissue helps this be minimized. We use a 3 cc syringe with a 30 gauge half-inch needle. I'm going to start with the lower. Rose, if you will look up for me. And I pull the eyelid down. I go in the subconjunctival sac and I do a very slow injection. And all I'm doing is watching it track along the lower eyelid border. And you can see that without moving the needle, you can see the border. So that is a perfectly injected lower eyelid. You did very good, Rose. Right here. Now I'm going to let that sit and that lidocaine with epi go in, and that will prevent bleeding and will allow me to work on that lower eyelid. We only numb one eye at a time because if we numb both eyes, by the time we get to the other side, that will be worn off. Now, let Rosa catch her breath. She's done very well. Give the patient time to recoup. And now we're going to do the upper eyelid. If you look down for me, Rosa, I'm going to pick the eyelid up with my needle, go through the tarsal plate, and just a slow, very slow injection. I'm making a bleb. Do you see that bleb forming? And it will track. If you're in the right tissue plane, it will track so quickly, it's amazing. And that's it. And there's a perfectly injected upper eyelid. And it's just with one injection in each eyelid. And if for some reason you're not tracking, take your bleb that you've made and just milk it. Milk it to the outside. Milk it to the inside. And just like if you were doing a filler and you were in the lips and you were milking it after you injected the lips, same. See, with that you've got a nice anesthetized area. Let's do a little permanent makeup real quick. If you're a patient watching, we shake our makeup on. This is called micropigmentation, and we use a needle with 5 to 7 points in it. It's a round needle. These points, so you have like 3 to 5 to 7 little needles all in one, and it reciprocates back and forth. And what we do is we pick our little line, and we just pick at it like we're picking a splinter out. Right along the lash line. It's important we stay right along the lash line, and we provide a little taper towards the end. So I'll do one little part here, wipe it off. Are you feeling anything at all, Rosa?
No.
How painful were the injections, Rosa, honestly?
Oh, they wasn't bad.
It wasn't bad.
No.
Well, I appreciate you saying that. You get another $25 off. I'm just kidding on it. All right, thank you very much.